Welcome to the next edition of the International Spotlight Program, where we join with our international affiliate partners and talk about global perspectives in aesthetic plastic surgery. I'd like to welcome Dr. Eugenio Gandolfi from the Italian Association for Aesthetic Plastic Surgery. Welcome, Doctor.
Thank you very much. Welcome to everybody.
We're so thrilled for the continued support of you and your members, and we'd like to talk a little bit today about fat grafting in your experience. How do you prepare your patients for the procedure, and what do you view as the greatest challenge in fat grafting?
I think the most important communication that I have to give, the information I have to give to the patient, then it's not only fat. So what we give to the patient is fat, but we have also a regenerative part, very important. So, and the second, this is the good news. The bad news is not all the volume that we bring will stay. It will stay. Mm-hmm. And this was a very big concern in the past. Now we know from our experience, from our scientific work, and 50% of the fat stay. We have a very good work on the fat transplant of the breast on the body, around 50%. Of course, can be more or less. And some patients have not to be sad to come out from the operating theater with a big breast and having after 3 months a normal one. Mm-hmm. But 50% we say. So good news and bad news. Good news is regenerative. Bad news is volume.
And so do you prepare and counsel them at the initial consultation about this and that they must prepare themselves for revisions and additional grafts?
Of course, patients have to be prepared of a revisional surgery. This is not very popular. It's not very normal in our surgery. Normally, we have a rhinoplasty, if you have to do, or breast augmentation, mm-hmm. or a tummy tuck. Of course, if you have to do twice, you have a problem. For fat, is normal. But we know that the regenerative property of fat, most part of the time, happen the first time. Mm-hmm. So it's depending what you want, what you're looking for. But for sure, it's not one-shot therapy.
Sure.
It's a life therapy.
So does it matter where the fat is harvested from?
Beg your pardon? Sorry?
Does it matter where the fat is harvested from?
I cannot really say from my experience, because I done in the last 10 years, I focalized in breast augmentation with fat. And up to now, I think I operated 220 patients, only for aesthetic and only bilateral and only with fat. And I can say then, I calculate the volume through MRI before and after, but I cannot really say then if I take from some part, the result is different. But I cannot say because I'm not looking for. I know from the literature that some area have to be are better candidate for this kind of. So the answer is no.
Can you tell us a little about your own research and studies in this area?
What can I say? This is the most fascinating thing on my job. I hope a lot of colleagues, as me, like to investigate medicine. I remember, I don't know who was in one of your conference in a aesthetic meeting. Finish the talk, say, show the picture of the first kidney transplant was performed in, I think, in US, and the first surgeon was a urologist. The second was a plastic surgeon. Mm-hmm. No, so the plastic surgeon has the challenge to be in the very, very beginning of some spectacular changing period of the medicine, and we are not alone now. 5 years ago, we was alone. Now we have other specialists working in this field. But using stem cells, we can change medicine. And part of the medicine is changed. So research, I remember 10 years ago, it was very, very difficult to find publication on fat transplant. Now, I cannot follow all the papers. Really, it's impossible. It's impossible.
It's an exciting time to be.
It's really fascinating and research, and what can I say? Now we know, we try to understand what's happened, but we are not. My research, in my research, I try to incorporate also the study of stem cells, so the count of the stromal vascular fraction 24 hours after, and it seems then more cells of the stem cell niche, more results, more volume. This seems to be true. Of course, now we have to understand what part of the stem cells niche is the most important. Perhaps not stem cells, some other part. And we work a lot on the method, transplant method, but is not really so important. The method is important, but most important is what we transfer, the product, and also the site, where I remember the study done by Dr. Khoury, Dr. Biggs, about using Brava. I use Brava since 2010, and with this period. So Brava demonstrated that if you work on the site, not only on the fat in the transplant, you have a bigger breast. And I calculated it was true. So it's fascinating. We are really on the top of the wave. And we have to serve.
It's an exciting time. We appreciate the support of you and your members. Relative to the relationship that we have, do you get feedback from your members about the journal or the affiliation with ASJ?
Of course. All our colleagues are very, very glad to have your journal. And as you told me during one, and Dr. Nahai told me, was with you during last meeting, our community, Italian community, work enough for publish in your journal. So we are glad. And we try to improve, helping people with technique and methods how to be up to date on publishing.
Well, thank you so much for joining us today, Dr. Gandolfi. We appreciate it, and we will see you very soon.
Thank you very much.
Thank you.